My name is Monica Cepin, and I work in Chula Vista as a primary care physician and I practice family practice.
Okay, so what was your education before you became a doctor, like college or med school?
I did 4 years of college, and then I did 4 years of medical school, and 3 years of residency.
Okay, and did you need an internship required? Was that required? An internship?
It's part of your residency. You have to do 1 year of internship and then your residency. But also I did it in my country, so I did it kind of twice.
Oh, okay.
Twice internship.
And how did you first become interested to become a doctor?
I was 14, and I had this cool biology teacher who was really motivating teacher and we studied the body, the human body, and I thought it was fascinating.
And are your hours and schedule difficult to maintain?
It was when you're in training, and when you work for hospitals, it's like no schedule. You have to be available all the time, and those calls are very long. But when you are in outpatient basis and you have your own practice, it's quite a nice schedule.
And what do you most enjoy and least enjoy about your job?
Well, what I enjoy the most is the fact that you can help others, and you can really build nice relationships with families and children, and it's very rewarding. And the worst thing that I like in my profession, I guess, when I lose a child. Like recently, I had a kid with a brain cancer and died. That's painful.
Yeah. And do you use your profession outside of the work area?
Well, when you're in medicine, you apply medicine on an everyday basis, and you apply it.
And what do you do on a daily basis at work?
Well, the kind of a job that I do is mainly outpatient, so I do see patients all day long. I get there at 8 o'clock, and I see one patient after another until 5 p.m. The fun thing is that you can be seeing a newborn that's just 2 weeks old maybe, and then you see an old lady, 92-year-old. So it's a big variety, and sometimes you see the whole family with the flu or something like that. So it's kind of a quiet fun.
And what is the hardest aspect of your job?
You carry a high responsibility. I mean, in my profession, you cannot make too many mistakes, okay? It can cost the life of a person, so you have to be very careful.
And were your parents doctors as well?
No. Nobody in my family was a doctor.
If you could trade your job for any job in the world, would you?
I will probably not. Probably I will definitely be a doctor. I may be choosing different specialties in medicine, but definitely I would be a doctor.
And would you advise people to go into pediatrics or a different unit?
You know, medicine is so wide and it's so many options, and I would recommend just be in medical school, start to do your internship, and when you're in your internship, you get exposed to surgery, to kids, to adults, all kind of medicine, and then you decided there what kind of a field you want in medicine. But it's not a specific thing that I would recommend. I definitely can say that pediatrics is a very charming, very fun specialty.
Okay, thank you.